Yet we have many nomenclatures.
The Ministry of Health is implementing various programs targeting the first 1,000 days from conception to 2 years of a child, like food fortification and micronutrition supplementation, among others, to address stunting in the country. Nutritionalists noted that although undernutrition in the country has improved over time, the country still has a long way to go to contain the situation.
So that's why we are introducing a formulation of multiple micronutrient supplementation for women who are pregnant. We know that private clinics have this formulation, and WHO has recently passed the guidance on its use, but in the government facilities we had not yet introduced it. So we are starting with a few districts. We are already carrying out implementation research to see as we transition. So it's a transition stage whereby we introduce these multiple micronutrients. And you know, multiple micronutrient supplementation is very good for pregnant women to ensure that we reduce the burden of birth defects.
So we receive stunted children. We give teachers to struggle with stunted children, some of the teachers who are themselves stunted, and then you find that the vicious circle. And when you talk about adolescent stuntedness, it is where, to me, is where the real crisis should start.
Because, it is transferred stunting into adolescence.
Because they will form a vicious circle. Further, you start with adolescent girl, adolescent boy.
During the Nutrition Society of Uganda stakeholders meeting on stunting, held at the College of Food and Technology at Makerere University, nutritionalists from all walks of life discussed numerous interventions to fight malnutrition and stunting. The current prevalence of undernutrition stands at 29% of children under 5 years are stunted, 4% of children under 5 years are wasted, 11% of children under 5 years are underweight, while 53% of the children 0 to 59 months are anemic, and 32% of women of reproductive age 15 to 49 years are also anemic.
Amongst those issues, to look at the human resources for nutrition, recently we were informed that there are no nutritionists around to propagate the information in the government entities. So I do recall the Prime Minister was advising the Minister of Public Service to look into the human resources for nutrition.
Helping communities or supporting communities end their own hunger. And right now, we are implementing a project, a 5-year project, which is called the Right to Grow project, and it is looking at stunting for children under 5. So we want to make sure that each child under 5 gets to realize their full potential.
While the Ministry of Health is still battling with the high prevalence of undernutrition, the country is also facing an increase in the prevalence of overnutrition and non-communicable diseases. Zahara Abigaba, UBC.